Valley Medical Center has built a reputation for being one of the best and most innovative hospitals in the nation. While the hospital's mission is to provide care to the neediest residents, VMC has also been the provider of choice for private pay patients. As a result, VMC has generated over $17 million in profits last year that was used to pay for providing health care to uninsured residents. The current board seems to be making decisions to make the hospital smaller and to put the $17 million and the services this money provides at risk. Will you pledge to ensure VMC remains a provider of choice for all residents so that we can continue to generate profit that is specifically used to pay for the health care for our neediest residents? Thank you.
VMC, I think, is just the ideal the way it works in the sense of trying to provide care to people who need it, but also bringing private money. And I think at least when I'm there, and I can tell you from experience, sitting there with the board, and they start talking about cutting and making it smaller, I know, I've been there. I have the experience. From day one, I can start talking to them how important it is that we maintain and improve maybe even expand Valley Medical Center. Private, public partnership, and if we can get that private money and make sure people with money, I mean, we have already the best burning unit in the West Coast. We have the best spinal unit. So if you get injured, that's where you're going to go. And I'd like to leave you one thing only. I was born in Valley Medical Center.
All right.
Okay. So I have a little attachment with that.
It is my view that we should expand the operations at the hospital because there's a need. We have, as has been indicated, we have some of the best doctors there. We have some of the best programs in terms of health at this particular facility. And this county is in need of resources to help backfill some of the monies that we're losing, some of the grants that we're receiving. We need to backfill, we need to take these assets that we have and generate them into revenue-producing assets. And Valley Medical is one of those assets.
I think the clinics that we provide also are amazingly valuable to bring services to the people. The Gilroy Clinic, for example, is an absolutely beautiful facility, very well used, incredible resource for the community, and we need to continue to invest in that distributed system. But my question is, why hasn't the marketing worked? So we've been putting a lot of money into marketing Valley Health Plan and trying to get more privately insured folks to select it, and they haven't. But I think there's a great opportunity now. Now that so many people are without insurance and they have been going to Valley Med, let's make sure when they get a job, they continue to come to us. They continue to select us as a provider of choice. So I think the time to do marketing is right now. Let's make sure that we convert those uninsured when they get insured to come back to us and to stay with us. So we have the great facilities. We've just got to make sure that we continue to show the value that we provide to the community.